Today's education coverage is brought to you by Lilly, a medicine company.
And Wish TV is your education station. Indiana lawmakers are proposing solutions, they say, to bolster mental health resources. The aim is to implement mental health care in rural communities of the Hoosier State.
News 8's Rena Revel looks into what is being done to bridge the gap.
According to Mental Health America, 65,000 Indiana youth with major depression did not receive care. House Bill 1574 proposes a school-based mental health pilot program to improve services for families in rural areas.
I think it's really critically important that we have funding behind those support services because many of the schools are not able to add additional services at this point. So having a pilot program that we can actually implement and see outcomes and see changes that happen, not just in students and their academic progress, but in the families that are part of the student support system is really incredibly vital.
Mental health in Indiana's rural areas is in crisis, marked by severe provider shortages. Mental Health America reports that rural communities have 20% fewer primary care providers and lack psychiatrists by 65%. This limited access to care is linked to rising suicide rates, which are notably higher in rural regions. This is why House Bill 1574 was introduced to address the issue.
We see that students themselves are experiencing increased challenges and increased needs to access mental health resources, but we also see a enthusiasm among our students to help to be part of the solution to the challenges that we face.
In response to the mental health crisis, the IU School of Social Work is taking action now to help support these areas. A recent grant of over $1 million will help the IU Center for Rural Engagement to develop faith-based, culturally relevant resources.
The lack of resources is complicated by things like stigma, that is still prevalent and a huge barrier to folks opening up and being comfortable talking about mental health, as well as accessing resources. Another challenge is transportation or accessibility of services.
This plan includes special training programs for pastoral leaders, workshops on postpartum well-being, resources for teens, and more.
We know that our faith communities are largely an untapped resource for us. And they provide an excellent opportunity for collaboration to deliver services in a way that meets people where they're at. So I hope that we can bridge gaps by empowering faith leaders with more knowledge and increasing accessibility of services to rural residents.
Reporting in Indianapolis, I'm Rena Revel for Wish TV, wishtv.com, or follow us on Facebook for updates.